We're going to continue our discussion of health care. With us for this, John Sheils of the Lewin Group. John has directed Medicaid projects around the country and testified in front of Congress just last week about some of his concerns. John, welcome. Mike Waldholtz, managing editor of Bloomberg's health team, also with us. Now, John, I want to make clear to everybody that you don't stand for or against anything. You're apolitical, and so is the Lewin Group. You're here for analysis. We thank you very much for your time. You just heard David Axelrod on the Sunday talk shows addressing the cost issue. You say there's only one option on the table right now that makes insuring everybody affordable. Give us an explanation as to why that's the case.
Well, most of the plans that we're looking at right now will cost between $1 trillion and $1.6 trillion over 10 years. It's going to be very difficult to find the money to pay for that. We know that some of the proposals that President Obama's put forward to fund things, capping the deductions that people have on in their taxes, we're not sure those things will actually be enacted. So what we really need to do is look at health reform models that actually save money. It's going to be very hard to cover the uninsured if it means that the government and society in general has to come up with just more money. We should be looking at systems that are going to make the overall healthcare system much more efficient.
So, John, why is the Wyden-Bennett bill the only one that's going to work here?
Well, it's the only one that we know of that is fully funded, fully paid for, and would actually we'd actually cover all the uninsured under that bill without increasing health spending. The bill has a lot of administrative efficiencies to it. We have, in today's system, small group insurance, individual insurance. The administrative cost can be up to 41% of the premium, which is a tremendous overhead cost. And if you move to a system where we take advantages of economies of scale in forming large groups, we could save quite a bit of money.
John, this is Mike Waldholtz. As I understand it, the Wyden-Bennett bill would favor a cooperative type of program, not a public plan as the administration is talking about?
It would not include a public plan as written. You could add one if you wanted to do that. It's up to Congress, but the CBO did a cost analysis of the proposal, and they say that in its first full year of operation it would be fully funded, with it being a little better than fully funded in years afterwards. So you cover everybody under that plan. It's paid for with the premiums that are collected under that plan, and it isn't going to increase the deficit. All of the other proposals now in front of us in Congress would increase the deficit because they have not figured out how they would pay for it. And that's always a stumbling block with health reform. It always has been. Where are we going to get the money to pay for all these additional benefits for the uninsured? It's actually surprisingly little money. It's about a 2% increase in what we would spend on health care nationally. But it's very difficult to come up with the money it takes to make sure everybody has coverage.
All right, John, thank you very much. That is John Sheils of the Lewin Group. He was joining us from Washington this morning. The healthcare debate continues.